Deputy State Director of Oregon, Senator Jeff Merkley, our junior senator who's making things happen for us. He is here to help. Prior to joining Senator Merkley's staff, Meribeth was Executive Director of Oregonians for Healthcare Security. So she was fighting in Oregon for us way before she went to Washington. And she received the 2008 Families USA Consumer Health Advocate of the Year Award. In 2006, she was appointed to the Oregon Senate Commission on Healthcare Access and Affordability. So we all give a wonderful welcome at our celebration to Meribeth.
Thank you very much. It's really nice to be back in Southern Oregon, and you know, I guess I want to start off by saying a couple of things. First, I want to say greetings from my boss, your newest senator, Jeff Merkley. But before I do that, I really do want to, not that you don't know, but this man. You know, I say this about smart, great people. He is a rock star. He was one of the very first people I met in Oregon when I moved here in 2002. He was probably like, who the heck is this woman? And will she please go back to Florida? I spent an inordinate amount of time in his office during the 2003 session, off campus in 2004, 2005 session. Actually, I think he thought he might get rid of me by encouraging Senator Courtney to appoint me to the Senate Commission on Healthcare Access and Affordability that he and then Senator, now Treasurer, Ben Westland co-chaired. So we've been in this battle together a lot, and I actually am really happy to be here with Dr. Bates tonight. I don't do anything in Southern Oregon that's healthcare related without him. And you know, you might be right. The feds might actually be getting their act together, and it's very interesting kind of going through the battles and the fights and the victories that Oregon has had, and the many conversations, right? Sometimes I think, geez, you know, Doc, how long has this been going on? And, you know, we had these sessions and little victories, and then the Senate Commission on Healthcare Access and Affordability in 2006, and I thought, oh, we're going to get all this stuff in '07, right? Well, we made many leaps forward, and, you know, it just seems like it takes a lot. So what I have come to realize is that change is slow. But the conversations that we have here in Oregon, you know, getting reports back from what's happening in Washington, because I actually work out of the Portland office, Nancy, wherever you are, it's the same, right? So they're talking about cost, of course, number one problem, right? We all pay the price, families, businesses, governments, right? It's unaffordable with $13,336 a year as the average family premium right now. Way too much. So the conversation around cost, around quality, around coverage, this outrage that we have, you know, 47, probably closer to 50 million people that have no coverage at all. The rest of us pay way too much, and then we find out after shelling out all that money that we actually aren't really covered for the things that we need. Nancy, right? Perfect example. And so when Senator Merkley was elected last November, thank you all very much, you know, there were two committees that he wanted to serve on. He wanted to serve on the Environment and Public Works Committee. He has a long history of passion around environmental issues, and he wanted to serve on the Health, Education, Labor, and Pension Committee, because the HELP Committee, you all may hear that referred to, because he is so committed to healthcare reform, and he wanted to be in the thick of it. In the end, he did get both of those committees. In addition, you should be very proud of him, he is serving also on the Housing, Banking, and Urban Affairs Committee and the Budget Committee. So he's serving on 4 committees. 3 of them, the first 3 I mentioned, are what in Senate speak they term A committees. Freshmen do not get 3 A committees. But they actually begged him, Senator Dodd, who is the chair of the Banking Committee in the Senate, they actually were like, oh, Jeff, we like what you did in Oregon on predatory lending. We like what you did around consumer protection. Will you come and serve on our committee? And then They were trying to actually get him off the Health Committee, but that's a different story, and he wouldn't do it. So here he is, right? There's nothing going on with the environment, right? Nothing going on with banking or housing or, you know, anything like that, and certainly nothing going on with healthcare. So he is incredibly busy in Washington and is really excited about the work that his committee, the Health, Education, Labor, and Pension Committee, did, passing the Affordable Health Coverage for All Americans bill last week. No, last week. Yeah, a week ago. And so that's very exciting. It talks about many of the same things that Oregon passed, right? Looking at quality. Why is it that America spends so much more than every other country in the nation and we don't get the access that we need?
We're better than Botswana.
Well, there is that, right? Go. And I think, you know, I agree with Senator Bates that the most important thing is really to hear from you about the questions that you have. But there's a couple of things I just want to lay out. One is that, you know, we've got the House of Representatives. There are 3 committees in the House that have jurisdiction on health care matters. 2 of those 3 committees have passed a bill, and they've come to agreement in the 3rd committee, and hopefully there'll be some action on that this week. And then there are 2 committees in the Senate that have jurisdiction. One is the Health, Education, Labor, and Pension Committee, and the other is the Finance Committee. Lucky for Oregon, Oregon's senior senator, Ron Wyden, serves on the Finance Committee. So we have both of our senators on the key committees that will make the healthcare reform efforts happen in Washington. And I know that we want to give Steve some time to talk, but that just kind of lays out where things are. It'll pique you to think about, okay, what the heck is going on in those committees then? We'll be happy to answer those questions as we go forth. Thank you.